Unless you've been living under a rock, you've certainly seen the now infamous Joe Namath Medicare commercials. In these commercials, the ex-NFL great tells you to call a Medicare hotline where you can get a new Medicare plan that's going to have an extensive list of amazing benefits. Now, a lot of people come to us and ask us if this commercial's a little too misleading, if it's a little too good to be true. Well, the FTC definitely thought that these commercials were misleading. In August 2022, they forced Benefit Technologies, the company that created these commercials, to give back $100 million in refunds along with other regulatory actions. In order to educate you, I'm going to go line by line in this commercial so you can protect yourself from any misleading claims. Two housekeeping things before we get started. The first is, this hotline is trying to sign you up for Medicare Advantage plans. I'm not going to deep dive into the difference between Medicare Advantage and Original Medicare in this video. If you'd like a more thorough explanation, check out this awesome video my colleague John O'Hara made to explain the difference between the two. The second is, this video is very general in scope. It's not going to go into any specific Medicare Advantage plan. In order for me to go into the bells and whistles of a more specific Medicare Advantage plan, we'd have to sign a scope of appointment in a more formal setting. So again, this is how the Medicare Advantage system works at large. Without further ado, let's dive into the commercial.
In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments.
Now, the first claim these commercials make is that they will offer you free rides to your medical appointments with one of these plans. While this is technically true, there should be a huge asterisk next to it. There are a handful of Medicare Advantage plans that do offer transportation benefits, but they're usually very limited in scope. We're talking maybe one ride per quarter or maybe even one ride per year. And you often have to book this up to a month in advance. This isn't you get to call a number and they're going to pick you up whenever you need to go somewhere. If you are looking for rides to medical transportation, always check out your local and state level options from your local and state level governments. For instance, in Ocean County, New Jersey, where we're based out of, there's a service called Ocean Ride that picks up seniors as long as they give them a 24-hour advance that they need a ride to a medical appointment. So before you decide to choose a Medicare Advantage plan based on the transportation benefits, look into the nitty-gritty details of how often you can actually use it, and also see if there's better options through your local and state government.
Private home aides.
Again, there should be an asterisk next to this benefit. This is not a home health aide that is going to be there all day or even weekly. If you're lucky enough to get a Medicare Advantage plan that has home health aide benefits, you might get a few dozen hours per year for you to use. If you need a home health aide, unfortunately, you're most likely going to have to pay it out of your own pocket.
Doctors and nurses visits by telephone.
This to me is the most transparent claim of any of the Joe Namath Medicare commercials. A lot of insurance carriers are starting to offer telemedicine services, and Medicare Advantage plans are no different. Telemedicine is great. It can save you a trip to the doctor's office and give you a little bit of peace of mind if something comes up. I myself have been using telemedicine for the past couple years, and I find it's great depending on the situation. You can use it via your smartphone, via a webcam, or even just your phone if that's what you'd prefer.
And even home delivered meals.
Certain Medicare Advantage plans do offer home delivered meals, but there is a catch. This is almost always tied to you coming off a hospital stay or some sort of major surgery. I wish there was a service that would always give seniors home delivered meals, but unfortunately this is contingent on you having a major hospital stay. Now, some Medicare Advantage plans are starting to experiment with some grocery benefits, but again, they are limited in scope and oftentimes do have strings attached, just like the home delivered meals do.
The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
This claim is incredibly misleading. Now, they are saying dental, vision, and prescriptions at no additional cost. You might be led to believe that this means all those things are $0, but it's not the case. They are saying you're going to get dental, vision, and prescriptions at no additional monthly cost. If you were to get dental, vision, or prescription insurance on the open market, it's going to cost money. There's going to be a monthly premium, plus there's going to be co-pays and cost sharing associated with the actual services you are getting. Now, here's the kicker. A Medicare Advantage plan always hangs its hat on a $0 monthly premium. There are some that have monthly premiums, but for the most part, what Medicare Advantage plans like to advertise is this $0 monthly premium. What they are saying is In that $0 monthly premium, there's going to be dental, vision, and prescriptions included with no additional monthly premium. There's still going to be copays, there's still going to be cost sharing, there's still going to be co-insurance, and sometimes this can be a lot of money. So just because you have no additional cost dental insurance doesn't mean that if you get a major dental surgery, there isn't going to be a high out-of-pocket cost with that. If you have expensive prescriptions, you're most likely going to have some very high copays with a Medicare Advantage plan. This whole no additional cost thing is really a bait and switch to get you to pick up the phone and think you're getting this stuff for free. So be careful and realize there are still costs associated with these dental, vision, and prescription services listed on these plans.
An expanded coverage for dental work that includes extractions, fillings, and dentures, all at no additional cost.
This to me is the most misleading claim in any of the Joe Namath commercials. They say extractions, fillings at no additional cost. They want you to think that you're going to get your extractions and your fillings at no additional cost. This is so not true. It's ridiculous. So they keep saying at no additional cost, and like we talked about in the previous claim, that means no additional monthly cost. Your dental insurance, your coverage is added into your Medicare Advantage with no monthly premium. Things like extractions, things like fillings are still going to have very high out-of-pocket costs. There's unfortunately no escaping it. There isn't a dental plan on the market that is going to cover these things at 100%. They are leading you to believe that it is due to that tricky language, but again, you're going to have very high out-of-pocket costs for these dental procedures. It's incredibly frustrating because they know seniors have these extractions, these fillings, these very expensive dental procedures later in life, and they really need relief because the bills can be so high. Do not be fooled by this tricky language. I know I sound like a broken record, but I have to harp on this. You are not going to find dental coverage that covers extractions and fillings at 100%. It's a very unfortunate reality, but don't be tricked into picking up the phone because you need these procedures only to realize that you don't have the coverage. Another note about Medicare Advantage Dental is that the networks can sometimes be rather small. Obviously, they like to really advertise the dental benefits and all the things you can get with it, but every once in a while, you're going to find that not a lot of dentists actually accept these plans. In fact, a few years ago, there was a Medicare Advantage company, I won't name names, that was really advertising their dental benefit. And when we looked it up, we found that there wasn't a single dentist in the state that actually took it. So if you need dental, be sure to do your due diligence. Make sure dentists actually take it. Make sure that has a benefit that you can actually use, and make sure you're not getting tricked into thinking you're getting more than you're actually getting.
Plus, depending on your zip code, you may be entitled to the Medicare benefit that adds money to your Social Security check every single month.
This claim is true, and it is called the Part B Give Back benefit. The Part B Give Back is a Medicare Advantage plan will work with Social Security to give you money back on your Social Security check. Now, this benefit is usually between $50 to $100 depending on the plan, so it's not a ton of money, but obviously every penny counts. This could be a huge difference in the lives of a lot of seniors. Now, even 2 years ago, I would have said there should be an asterisk next to it because there weren't a lot of plans that offered this benefit. As you can see in the commercial, they say depending on your zip code, you can be eligible for this. There weren't a lot of zip codes that had this, but recently a lot of Medicare Advantage plans have been offering this to sweeten the deal a little bit. And in New Jersey, there are several plans this year that are going to be offering this going into 2023. So this is a great benefit for seniors. We're really happy that it has been expanded, and we're hopeful for the future that more plans will offer it as well. We just went into one of the biggest commercials in the Medicare industry. We went line by line, and it can be frustrating to learn how misleading some of these claims can be. We can't tell you how many times people have come into our office and said, I got this plan because I thought I was going to get this, this, and this, and when the plan actually started, I realized the benefits weren't quite as robust as I thought they would be. This is why you should work with the trusted brokers at NJ Life and Health. We are here to educate you at no cost to you to make sure you are getting the right plan for your specific health needs and there's no surprises along the way. Reach out to us at www.njlifeandhealth.com to schedule your free appointment and learn more about us, or call us at 848-226-6897. Also, be sure to like and subscribe to our channel. We're going to be posting a ton more content that is directly meant to educate you and help you understand Medicare further. Share this video with a friend who you think would enjoy it, and be sure to check out our YouTube, our Instagram, all these places, as we will be posting a lot more educational content in the future. And we already have a bunch of great educational content on this channel, so be sure to search through and see if you learned something and comment what you learned. So thanks again. Reach out to us at www.njlifeandhealth.com to schedule your free appointment and learn some more.